moderator. With me today is Brandon, John Paul, and Brandon. Our first topic will be marijuana and alcohol policies, medicinally. Brandon, would you like to take us into our first topic?
Okay, if we're talking about cannabis and alcohol policies, I'll just share with you how I went about the research. It kind of took me understanding that I'm going to be looking up statutes, regulations, and ordinance that go from like a state level down to an agency level and then down to a city and county level where they're managing the consumption and production of either cannabis or alcohol. When I go into studying for medicinal properties of alcohol, I started just with the Alcoholic Beverage Control Act of 2026. From there, just from the get-go, it starts telling me about the Constitution. It talks about the 21st Amendment from 1933, repealing the 18th Amendment of Prohibition. And then it goes into like state power, state limitations, and it designates the Department of Alcoholic Beverage Control as the agency to manage that.
Do you know like how so? Like what are they doing to designate that and bring that to?
Yeah, so that's like that's what the Constitution, the 21st Amendment does. It designates them, and how that works is that legislation from state government, they'll decide a law, that's statutory law, and then they'll hand that off to the Alcohol and Beverage Control, who will make administrative law. So that's where they assign the legislation. That's the interpretation of the law as seen by the agency who's going to license and regulate it. So that's what they do. They interpret it, they build their own policies, and even then, it's not something that they enact, it's something they hand off to like municipal level, so municipal law, like the cities and the county. And so, like I said, that's what the 21st Amendment does, and that's available in the Alcoholic Beverage Control Act, not just 2026, but it's like pretty much the first thing you see in all previous years. They just like, looks like they copy and paste it so that they don't have to do extra work.
Constantly, just to.
The next thing I'm looking up, I'm finding the National Minimum Drinking Age Act of 1984, which is like around then there starts to be advocacy groups like Mothers Against Drunk Driving and stuff like that. They're having an issue with the age limit. There's a bunch of statistics being released by the Center of Disease Control and Prevention talking about traffic.
So the age was 18 at that point in time? It was.
As far as like my research and what I gather is that there's a whole thing about if you could serve in the military and die for your country, but you're 18 and you can't drink alcohol, that became
that doesn't make
like a hyper focus of some sort. And from what I gather, the drinking age was 18. But like I said, with that youthful consumption and the traffic fatalities and
stuff
such,
like that
the government pretty much wanted to use the National Minimum Drinking Age Act of 1984 and in a way that they kind of pressed states to utilize that and raise their limit, was telling them that, hey, if you want your highway repair funds, you're going to have to abide by this act. So it seemed to work pretty well. Again, there was other influences, not just that. So again, I'm still like going through, I'm still looking for any policy related to medical or medicinal with alcohol. So from there, I end up at the National Institute of Health website. That's NIAAA.nih.gov. That's their website. That the NIAAA, that's the National Institute of Alcohol Abuse and Alcoholism. And so they talk about public possession. And then when they go into what's not public possession, that's the first time I see anything about medicinal policy. And it's saying that if you're like caught drunk in public or something, but it's like in line with your religious beliefs and you're with an adult or a guardian, or you have medicinal if it's a recommendation from like your doctor. So that's the first or like only thing I see as far as policy with alcohol goes. So
and that was when IDs were imposed. Do you think that IDs being required for alcohol was effective to reduce the amount of deaths that alcohol has made?
I mean, me personally, my personal thought of it is like with anything else, like you could put constraints or limitations on something, but human beings are super innovative, and anything they apply themselves to consistently, they're gonna figure out ways to succeed or accomplish that mission. So, and even like you're asking, and when I'm mentioning this is talking about things from like decades ago. It was probably way easier to get away with not using an ID to get alcohol or to buy, purchase, or consume alcohol. But that's just like what I would presume, you know, with very little evidence. You know what I mean?
I think it's mostly like when you tell humans, oh, you can't do this. We need you to do this. I think it just makes human nature like, nah, I'm gonna go ahead and do it anyways. Like with prohibition, everybody was like, oh, you tell us not to, I'm gonna just go drink anyways. Like IDs with alcohol, I'm pretty sure people were like, yeah, I'm not gonna show my ID anyways, and still get alcohol. I mean,
Yeah, but that's probably why they start making policy.
yeah,
They start
exactly.
making
Because like one piece of paper is not going to stop you from buying alcohol, getting drunk, and then dying in a car accident.
I mean, you got to think back then as well, they were also distilling their own alcohol. Prohibition was a thing, so there was a lot of underground distilleries that still produced alcohol that I guarantee was still selling under a table.
Yeah. So I mean, yeah, talking about prohibition and how it didn't work. you
It
know,
definitely didn't work.
you know.
Prohibition did not work. I mean, realistically, it caused more of a issue than I think they intended. Because
Yeah.
once they did prohibition, then it was just like, okay, you don't want us to drink. We're just going to make literal places dedicated to drinking. And that's, I think, where the influx of bars came into play in the Bay Area was prohibition.
Mhm.
I mean, when you really think about it, there were speakeasies in San Francisco. There's underground pathways to different little nooks and crannies of San Francisco that were made due to prohibition.
They're treating this shit like the black market.
It was the black market, John Paul. Prohibition was the black market because you couldn't buy alcohol at a store. You would have to say, hey, Alvin, you know someone who got some alcohol? And then Alvin would say, hey, Brandon, I got dude over here that wants to buy some alcohol. So then, there was no stores involved. It was illegal.
And this kind of parallels us transitioning into like maybe medicinal cannabis too, because there's
Right.
prohibition on
Yeah,
cannabis
there's
up
prohibition
until
on-
recently as well.
Yes.
You know, so but
Yeah. Transitioning into medical cannabis. I got a few facts that I searched up from Public Health Central.gov. Cannabis is the most commonly used federally illicit drug in the U.S. In 2021, prevalence was 18.7% amongst individuals ages 12 and older. Yeah,
12 and older, huh?
12 and
What?
older. Yeah.
Okay.
Speaking about permission, I mean,
This was probably, some kid students going after school to go get some, marijuana from their dealer, or just people accessing their parents' stash without them knowing, and a lot of this is probably just bad parenting, honestly.
Okay. Yeah, I guess like that's talking kind of about like usage. As far as like looking up policy though, it's just like a whole nother deep dive for me. Did you find anything about policy?
unfortunately not.
No? Okay, well, as far as what I found in my research for cannabis, I started looking at the DEA.gov website, looking for, like at a federal level, what's going on. And so from there I'm reading about scheduling, Schedule 1 and Schedule 2. It's saying that Schedule 1 and 2 are for high potential of abuse or dependency and addiction. Schedule 2 are moderate. Schedule 3 and 4 are low in the lowest risks of dependency, addiction, and abuse. And so I found that at the Drug Enforcement Agency website. From there I hop over and I'm looking at more legislature from California Health and Safety Code. From there, it's actually showing what things are scheduled in those different categories. And so for unprocessed cannabis, it's a Schedule 1. And the idea is that there's no acceptable medical use. So my first thing, shifting into medicinal cannabis, medical cannabis, I'm finding that at a federal level, it's considered to not have any acceptable medical use, which is like wild to me from the rest of my research that I was doing. And just like as a note, as far as unprocessed cocoa leaves, unprocessed opium poppies, or the poppy straw, those are Schedule 2, which means they're accepted to have some.
Opium's more accepted than marijuana on the scheduling scale. Well,
yeah, that's
technically
according to Health and Safety Code at legislature.ca.gov.
That's crazy.
Yeah.
Heroin is.
And so from there, again, I'm looking at policy. First, I see Proposition 215. That's the Compassionate Use Act of 1996. That's where they're offering medical marijuana rights, right to treatment, and protections for patients and providers. What's kind of neat is that there was specific medical ailments that you could give a license to consume cannabis, but because of wording, they said, quote, or any other illness for which marijuana provides relief, and that's highly probable why you saw such a big boom
and everybody getting a script in 2012,
a
2008.
Wait, did that not have expiration dates? Like
No,
the
it
script?
was-
they did.
it
You had
was
to get
every
an
year.
annual. Yeah, it was
Every
an
year you had
annual.
to go and get one. There were some doctors that gave you like a 5-year length one, and there was other doctors that only gave you like a month, 2 months,
Yeah.
3 weeks.
And how often would these patients get their prescriptions? Like per month?
No.
It's not a prescription like you would think. It's just a piece of paper stating he suffers ailments, she suffers ailments. Marijuana is good to help.
Yeah,
prevent some of these ailments.
It's a year-long prescription.
Yeah.
Anytime you run out of your prescription for a year, you could go up, and as long as it's within the regulatory limits of what you can get, that's what it is.
I think it's 28 grams.
Yeah, and then it's not technically it's not a prescription because it says this act helped with doctor immunity because federally it was illegal to prescribe, but it's not illegal to recommend. So that's why you have doctors' recs. It wasn't
Yeah,
considered
yeah,
a
it was a
prescription,
rec.
doctor
Did
recommendation,
you got your rec? Yeah.
or it was a oral or written approval.
That
So
was-
these are like, again, what you're hearing is that within law, if you're not using specific words, it affords a
twist
bit
it.
of leniency within that law, and people are going to exploit it, it seems like.
Yeah, and that's how they treat these products like it's the black market.
Correct. And so that's how we loop back prohibition and stuff like that. You have people who are, grabbing things from their medical recs and then redistributing.
Yeah.
Stuff like that does happen. That's similar to alcohol. But from there, I researched and found Senate Bill 420. That's SB 420 Medical Marijuana Program Act of 2023. That's where it goes even more into the public health aspect. That's when you're talking about the state medical ID cards. You have the protection from arrests and protection or assistance for people who were arrested for the drug on war. So when Senate Bill 420 came out, the policy was that people who were negatively affected or adversely affected by the drug on war for cannabis, which is now they're saying, okay, it has medical properties. Now you have adult use of it, but we also threw people in jail for it, and they're still in there.
They were
So-
basically digging their own graves.
They're kind of trying to save face is what they're trying to do. It's like saying you're bad for something, you get in trouble, and then everybody's like, it's not a bad thing now. And you're like, hey, why did I get in trouble? And so now the state's like, okay, well, what we'll do is we'll take you out of timeout and we'll let you work with the people that make the cannabis, those companies, and they'll assist you with if you need help with the job or if you need help with medicine or if you need help with anything. So basically it's
I see.
with the
That's a fair trade, dude.
with SB
It's like
420.
What is that word called? Where there's a word for it, where people that got locked up and then the law changes and then they have to
Retroactively.
Yes, they have to
Retroactively.
retroactively implement it.
Yeah, and so that's what they're doing, trying to save face. They're like,
Yeah.
let's go back.
Yeah,
I'm not
let's
certain if they
let this
changed
guy-
like the actual case files or anything, but when I worked in a lab in Oakland, we had an equity partner. It's the same thing. It's like whenever they need anything, they hit up. You do anything, you could assist them if they need meds or if they need employment or anything like that, resources and stuff like that. So you do see with the SB 420, that bill that they're attempting to, you know, make amends for other things that the first bill or proposition didn't cover. And so that's medical marijuana. When we go into Prop 64, it starts transitioning into more about a recreational thing. So as far as me studying medicinal cannabis, those are the sites, that's what I found. You know, like there's things where like the medical patient can have a certain amount of flower, I think it's like 8 ounces, and they can have a certain number of plants. It goes into regulation on if they need to be in veg state or bloom state, things like that, if you understand cultivation. But that's where I finally hit like a sensible policy or the data necessary for medicinal cannabis.
John Paul, do you have anything else for medicinal cannabis?
Medicinal cannabis so far? No.
Brandon, would you like to take us into what you have?
So for medicinal cannabis, I found a couple things. There are always new studies coming out for marijuana every day. They're trying to figure out how to implement it in separate fields of research. According to Science News Today on April 23rd, 2025, there is currently ongoing research right now that marijuana can counteract or fight off cancer cells in the human body, as well as Alzheimer's and AIDS. It's pretty crazy. You should look into it. Basically, the argument is why would we be doing chemotherapy? Why would we be subjecting people that have cancer to chemotherapy, radiation, when marijuana in high doses will kill cancer cells? There's medical research to prove this. Like there's this oil called Rob Simpson oil, RSO oil.
You're talking about Rick Simpson.
Rick
oil.
Simpson oil, thank you.
RSO, yes, sir.
RSO. I worked at a cannabis industry for a few years, and when I was working in the field, this lady told me that her father was dying from a brain tumor, and she gave him RSO, and the brain tumor, he went in and it was gone. And so they used her case to study in Berkeley. Yeah, so it's
I guess as far as that goes, I do have a citation. It's from the National Institute of Biochemical Information, NCBI. It's another department or extension of the National Institute of Health. It was published in August 2020 by Yotam Hode, and it says that the healing of power from cannabis is likely the terpenoids, and phytocannabinoids. It says, but particular compounds, the amounts, or the ratios are important for the treatment of particular diseases.
yeah.
So it sounds like within that, you know, I don't know what research you have about saying that it kills cancer cells, but it seems like it's intricate. There's complexities to it. But I would suggest going to that website, going to the National Institute of Biochemical Information, because if you go there, it's not like a quote in an article. It'll go through, you'll see all of the analysis of different strains of cannabis. They break down all of it's basically like looking at a certificate of analysis. It shows every terpene, every cannabinoid for dozens of strains. It has like the abstract, it's scientific method. So I'm not just like, it's interesting on a complex scientific level, and we need this, I perceive, we need this a little bit more in communities or in the culture, not just saying like this is why I like it, but actually citing reputable sources is going to maybe shift, if not opinions, maybe even policy, you know, stuff like that. So I did want to throw out, like, it's not saying that it just kills cancer willy-nilly and stuff like that. You know, we're actually...
Well, that wasn't I mean, I guess that was implied by the statement, but no, it's more along
I hear you.
the
I'm
line
supporting
of,
what you're saying.
Yeah.
Gotcha.
I just want to go back and say it's not really it kills it altogether. Like, oh no, it's gone. It just helps.
It's kind of like how they said alcohol can.
Well, cancer's a cell mutating and losing a portion of its DNA. So on a molecular level, cancer, just one portion of your DNA sequence in that cell is messed up, so it turns into cancer cell, right? Cannabis tries to prevent that cell from growing bigger, from living. I mean, all cells are living, so it just tries to prevent all that.
Was that the only case, or are there more?
Oh, there's tons of cases. There's this girl that was out in Colorado. She suffered from seizures and stuff like that. And this was back when cannabis was just getting not the industry was being developed at that point in time out in Colorado. So she was having seizures and stuff like that, and her parents were giving her high doses of cannabis oil, and she stopped having seizures. It's a famous story. You should look it up. There's a whole documentary of it. I forget the name of it off the top of my head, but it's really interesting. So yeah, there's a plethora of cases that cannabis has been used in the treatment of many illnesses: PTSD, cancer, Parkinson's, insomnia. The list just goes on.
Yeah. Well, John Paul, do you have anything else for marijuana? Medicinal or recreational?
We're on
Medicinal.
medicinal.
Medicinal. Oh, now since
Yeah, good.
we've got the gist of medicinal purposes of marijuana, we can now transition into recreational uses for alcohol and marijuana policies. Brandon, would you like to start us off?
Yeah, as far as research for alcohol, it's just basic stuff. I got some websites if you do want information as like someone who would like a license or understand wholesale and tax a lot more. The Bureau of Alcohol, Tobacco, and Firearms released a statement in January of 2003 and shifted the tax and trade regulations for alcohol and tobacco to the Tax and Trade Bureau. So you'd have to go to the ttb.gov website. That's where you find manufacturing, wholesale, or import information. And the other site is again just alcoholic beverage control website, abc.ca.gov. That's again at the higher levels. And then if you want more local information about alcohol policy, there's the Solano County and Fairfield ordinances. You can find that on codepublishing.com/CA. It's pretty much like you can put in any city if you want after CA, California City, and you'll get the ordinances and stuff like that for alcohol. So I guess other than that, it's basic knowledge with with policies for cannabis, don't drink and drive, public intoxication and
Don't
stuff
smoke
like
next
that.
to a school.
Or as far as alcohol and recreation, there's things about the blood alcohol. Do you guys know the blood alcohol level that you could have to get a DUI?
0.08.
Is it 0.08?
0.08
Yeah.
still.
It's
I'm
about
pretty.
point-
0.7, 0.8.
Yeah, and so then I think it's lower. If you're underage, you can't have any or
Zero.
something. Yeah, is it zero?
0.
Federally, it's point
0.1.
point
0.001.
Is it really?
What are you gonna do?
Yeah, it's lower.
Eat a high yeast content bread in because that's really there's research that people that ate high content yeast breads and stuff like that, they would show up with a high ABV, but it's not.
Yeah.
Not even high, just 0.01, 0.
Can't you-
Like you do
can you
mouthwash or something.
Yeah.
Can you get drunk off kombucha? Or is that
I'm not sure what kombucha
No?
is.
Okay. I know what you're talking about. It's a fermentation. It's got
Yeah.
a fermented
Oh,
culture
it's the-
in it.
yeah.
And it has low. So at the Alcoholic Beverage and Control website, they talk about what constitutes an alcohol beverage, and it has to have half of 1% of alcohol in it.
And kombucha is what,
So
0.005?
0.05% alcohol in a beverage constitutes it as an alcoholic beverage. So if kombucha is not considered alcohol beverage, I would presume again that it's under 0.05% alcohol by
Yeah.
volume.
And that's
Okay.
considered safe, below 0.5%.
How much kombucha are you gonna drink?
I have never heard that.
I'm
I've
just
never
saying,
heard of
it
that in my
probably
life.
could be
Yep.
a low percentage, but if
What's cool is during my research for the alcohol recreational policy, is that death from excessive alcohol abuse is the leading preventable cause in America, according to the CDC on August 6, 2024.
So they're saying to drink yourself to death is the most ridiculous way to die?
Basically, you can prevent dying from your liver giving out or something like that from overconsumption of alcohol or like DUIs. I don't know. I didn't go into all the statistics. There's a lot of deaths from DUIs.
Well,
Yeah.
we're on recreational marijuana.
So it can just
now,
like happen out of
right?
nowhere.
No,
Yeah. I just-
so your
I
body,
shifted into alcohol.
you need
Okay.
your liver. If your liver goes out because you drank too much alcohol, your body's not going to have a way to metabolize anything. So you die.
Okay, so that's like the
And then
priority.
drunk driving, that's alcohol contributed deaths in America. I'm pretty sure drunk driving is in the list or,
Because of fog judgment.
well, I
Most
mean,
of the time.
yeah, I mean, there's the argument to say, well, if that person wasn't drunk, he would have never crashed the car. But I like I said, I don't know. Second thing I found very interesting about alcohol compared to cannabis policy is that you can drink alcohol and get financial aid, right? You can just drink alcohol, it's fine. You can have financial aid, right? But since financial aid is a federally funded thing, and marijuana is a Schedule 1 on the federal scale, if you smoke marijuana and go to school, you do not qualify for financial aid. Period. You can get kicked off financial aid, and you'd have to pay back any financial aid that you receive if they find out you smoked marijuana up to a certain point. And that is according to...
How do they obtain that information?
Right, that's
They
what
would
I
have,
was
they would
thinking.
have to
I-
catch you in the process.
They would have to.
or something?
I'm assuming they would have to catch you in the process and just like make you pee test. And
Like
I don't
they would
know.
have to pull you over like at some point.
Yeah, I'm not sure that there's any college campus that's going to administer a drug
A
test.
drug
on
test
me.
to that extent, but I'm just saying it's kind of crazy that you can go out and get drunk, but you can't smoke a little bit of reefer.
Mm.
Like, it's crazy,
Well, I guess like shifting from like from
and that is from campusdrugprevention.gov, and it relies on the Constitution.
okay, so
The
that's like
Schedule
that's
1
like
Act
at a
you were talking
campus level,
Yeah.
you know, which is like inside the city kind of thing, you know, like
I just found it was very
I
interesting.
get it's like its own thing. I totally get
Its
that.
own
It's
little-
got its own regulations and stuff. So, but like as far as outside of campus stuff, I guess like I like to talk about Prop 64 and the things like leading more up to current cannabis
mhm.
policy, so that we can see if that makes any sense according to what we got with like
I
current.
do not believe
So,
it
so
does.
Prop 64 is the Adult Use of Marijuana Act from 2016. That's when it's like the official age for adult use is 21 and up, where before it was primarily about
Correct.
medical recommendation, which I think then and now was 18 and up was the policy for medical.
Mhm.
So with Prop 64, they transition and go adult use now. You could use it 21 and up. They put limitations. You can have 28.5 grams of herb or 8 grams of hash, so a concentrate or extract. They go into non-commercial cultivation, like your own personal, if you want to grow cannabis yourself. Adult use, not medical, so this is recreation. You can grow 6 cannabis plants, whether they're in veg or bloom. That's
Six
its own.
isn't.
Six
Six is nothing. Like,
I mean, we could go into that if you would like. You know, if you understand cultivation with cannabis, you know, there's different cycles based on the amount of light that the plant's getting.
Yep.
You know, and when you're trying to have a consistent production of medicines, it's dialing in those cycles. And so what you end up with if you only have like 6 plants is like a,
222.
well, if your veg cycle is shorter than your bloom cycle, you end up with plants ready to be flowering, but they're stunted and stalled because they're waiting on these other ones, you know, or like so it just adds like if you don't understand cultivation, something as simple as going, you could have 6 plants. It doesn't matter if they're veg or bloom, it's 6 only. You're not really understanding the issues that somebody who would like access to medicine or something like that could get. But also, this is specifically for adult use, which is recreational. So, in addition to that, they changed the name of the regulatory agency for it from Bureau of Medical Marijuana to Bureau of Marijuana Control. And they include a lot of information on taxations, revenues, child protections, and criminal justice reform. So more of that, assisting people who have been adversely affected by the war on drugs, specifically cannabis. Child protections goes into like labeling packages properly, making sure that they're tamper-proof, so some child can't get a hold of a cannabis product or something like that, you know, and consume it or something. And then again, taxations and revenues, that's more of the licensing and business issues that are fallen into, because I think I don't know if you went into collectives or dispensaries, but they usually like would wrap in the taxes, and so you really wouldn't see it, or it wouldn't be.
It would be according to the price. Because I used to be a bud tender back some years, so it was just, some places it was the price is what you see, other places it was the price, and then I got a tax 15, 20 over here, and then your $20 went to like 35, and it's like, what the?
Yeah, you got to kind of shop around to find the right.
Well, that was back when the medical recs were first a thing, you know what I mean?
Yeah. And so after that, again, it just seems like they're just trying to dial in what they want to do with it at a state level. They have a Senate Bill 94, which comes out a year later, and they're still just trying to dial things in. That's called the Medical and Adult Use Cannabis Regulation and Safety Act 2017. You can see that again at legislature.ca.gov's website. They go into more about the agency. It transitions from like the Department of Cannabis Control again to the Bureau of Cannabis Control. And then they set designators for what they're talking about. They have A for adult use and M for medical as far as how they're talking. If you are engaged in business with these agencies to make sure things are more specific to what you're handling. They go into like mandatory testing. So around this time, it's like if you want to consume recreationally or medically any cannabis, they're obligated by law to get certificates of analysis where they test for pesticides, molds, metals, anything like that.
Yeah, they were having a mold problem.
And so from there, they also, it's like they put a huge focus on track and trace, which I mentioned to you earlier, which is like with policy now, if you have a cannabis seed and it's going from a seed to a plant, and from a plant into an extract, and from an extract into like a drink or an edible, and that whole process, there's a number that will be with it throughout the whole lifetime of that cannabis plant. And so at the end, if we go to the store, you and I both can get a box that was processed from the same cannabis plant, and we'll have the
Different
same number
numbers.
because we both it is
Oh
the
yeah,
same.
because it is the same
Yeah,
plant.
so like that's like again when we're talking about the track and trace, that's done by metric compliance. So metric and the Bureau of Cannabis Control are consistently coming through labs, dispensaries, micro entities and stuff like that, and like inventorying everything. You know what I mean? And so when they do that, there's already a designated software system that they're using, and that's metric. That's their track and trace. And so I guess like that's as far as like strict kind of like state related and business related policies. That's where like my research took me. Was there's lots of transitions trying to dial in things that were once illegal and prohibited in something that's sensible and functional for people who require or like access to it, you know? And so as far as changing policy or influencing policy change, I guess like as I'm researching this, you know, there's a whole lot of clarity on how major of a feat and how many people have to gather together to make that kind of change, to get whole agencies to shift.
I remember back in the day, it used to be banks didn't want to support cannabis industries because the money was bad, so they only could use cash. And if you ever had a debit card, they would turn away your service or have an ATM that had overpriced
Yeah.
charge fees because banks didn't want to handle cannabis money.
Yeah.
It was dirty money. It was drug money. But now, you can go into a cannabis club with your Bank of America card and swipe it, and that's a
Yeah.
big feat because now banks aren't saying, "Oh, this is a drug money." They're actually backing the companies through the FDIC,
Hmm.
Federal Department of Income Control.
Okay.
Pretty
Yeah, and so you're talking about the policy for banking in the
Yeah.
cannabis industry, and the negative impacts of that is you have a bunch of people that know if they hit a cannabis business that there's
All
a high,
cash.
high probability of large amounts of money on site. So,
Yeah, and that's a problem.
around what year was it? Was it 2019, 2020? There was like the George Floyd chaos was happening, and
Well,
there's lots of riots. During that time period, my lab and numerous cannabis businesses were looted.
I was working at Stizzy around that time, and we had a delivery truck get robbed
Yeah.
during that time. Like, they held up the delivery truck, robbed the whole truck for
Which is just saying like opportunists.
Yeah,
So
it's-
with the
it's-
policy where
it's
you
crazy.
can't bank and you can't like put your money in a secure place, it kind of breeds that type of situation.
mentality for people. Like, hey, I know that they can't. So I mean, it was for me that was a giant step. Like in the idea and the realism that cannabis is a lot more healthier than alcohol to me.
Huh.
Okay, well,
Yeah. Do you have anything else, John Paul, for recreational use? Marijuana?
unfortunately not. Well, not until moderation, unless you want to go over that.
Yeah. But let's now that we've wrapped up recreational use for alcohol and marijuana, let's go ahead and go into moderations for alcohol and marijuana. John Paul, why don't you start us off?
Well, I mean, for cannabis, the only way that I know for people to recover from smoking is to use nicotine patches. It's simple, but, well, from what I've heard, it's gradually effective.
Mm.
And, well, regarding alcohol, well, according to this original article from Jocelyn Mueller on May 2026 from Substance Use and Misuse, people are using cannabis as a substitute for alcohol because it has less side effects and lesser risk for addiction. However, there are only very few cases of this, so whatever you do, take it as you will. But aside from that, for alcohol moderation, I'd say do whatever you want to do that makes you happy. Like, if you want to like start gaming to get away from
Yeah.
alcohol, yeah, I do that because like I'd be gaming on Minecraft or
So
well,
just fill your time up with something else.
yeah, maybe go on a walk, touch grass if you may, perhaps.
Right? Walk around the lake, get some fresh air, breathe a little
Go
bit.
for a hike.
Yeah, go for a hike, yeah.
Yeah, it's like when I was talking to you about how like when I would drink a lot years and years ago, it's because I was bored. It was like just boredom, and
Yeah.
like also mentioning how it's like this auxiliary thing that you do aside of other tasks. So it's like throwing a little imbalance on top of anything that you're going to be doing, but that's what I was talking to you about, moderation.
Yeah, and I agree. Those are more than ways to get your mind off alcohol or marijuana. Another way is reducing the cost of transportation to get to the places for treatment, counseling, or any doctor visit they need. Because that way you don't have to go through. I'm like probably having an episode where I'm craving marijuana. Not me, but like say like Joe Smith right here is craving alcohol. He gets up in the morning. He's craving alcohol. He's sweating. He's doing whatever it takes to let him know he's in a bad shape. traffic. Just cut off bus transportation. Give them like $2 for a bus pass. Make it free. Give marijuana users and alcohol people who have issues free bus passes. How about
You're a
that?
veteran.
Yeah.
And so when I go to Veteran Affairs, they got the North Bay Center in where's that, Martinez. When I go there, I sign a paper when I go to like the group meetings, and they reimburse you for your transportation. So I like that you say they should have more policies, to assist the people that need to get to treatments and stuff, but also like throwing in like certain times you are able to get it. So there are policies, but it'd be nice if they had more policies.
Well, a lot of these treatments, they prescribe you medications that really, let's say, help you with one thing and screw up 7 other things. So now you got to take 5 more medications to fix that one thing.
Yeah.
When people are just like, I'll just drink or I'll just smoke. So I mean, it's
Yeah, and that kind of like that shifts a lot of from what I'm experiencing with veterans, but I'm sure other people into alcohol consumption. And so, like me personally, I don't produce or consume alcohol medically or recreationally. 65% of in and outpatient veterans report alcohol as the primary substance that they're abusing. According to American Addiction Center, their veteran statistics at veteranaddiction.org, it's a website. Leah Miller published in April of 2026 that military culture, stressor exposure, traumatic service or combat, onset mental health disorders like PTSD, chronic pain, and other health ailments usually cause that substance use or abuse. And so, as far as like other reasons that, like I'll moderate or don't use alcohol at all is because of how it affects my body. Alcohol consumption, single occasion or several occasions, it seriously tolls our health. Another National Institute of Health published paper talks about it's not just your liver, it's your brain, your gut, your pancreas, your lungs, your cardiovascular, and your immune system are affected adversely by consuming alcohol.
Because of that dopamine release. Isn't it?
Okay, so like from what I understand, when you drink alcohol, it goes down in your stomach. There's a lining in there that protects it, and alcohol forces your stomach lining to kind of like betray itself. There's other things like how because of the sugars, it will cause you to dump more bile, like acid, from your pancreas, which puts it into hyperproductivity. There's also like the chemical transmissions in your brain when you consume alcohol, the pathways that your chemicals travel are mushed. So like think of a hallway where the walls start getting all like compact and mushed together. So it impairs the chemicals to be able to go through those pathways, which gives you that impairment where you start to lose your inhibitions and stuff like that and make poor decisions because you're not getting the signals from your body or your brain that say, don't do that.
Oh, so it basically just dulls your senses.
Yeah, but like again, I believe in personal agency. So like I really, personally, I will not consume it, but I really don't care what other people do. You know what I mean? So my policy is I don't consume it, but I don't have any like, like I'm sure like I observe like monks drink, like all kinds of like different groups or cultures consume, and it doesn't become like a major issue that I'm aware of. So I'm not against it. I just personally don't consume it, or that's like my moderation is not to consume alcohol.
Yeah. Yeah, I mean, Brandon, do you have anything else to
at
jump
the
on?
moment.
Dude, it's ironic how little we had about alcohol towards the end. Meanwhile, we had like a shit ton of stuff about alcohol at the beginning. We had a ton of stuff about cannabis in the middle, but like at the end, we have like, well,
Yeah, I mean,
not
you
much.
can't find much on alcohol being medical or medicinal, because alcohol is honestly used for people who, want to use it for therapeutic reasons like depression, chronic pain, stress, anxiety, and people who use it recreationally also use it therapeutically. So that is what really increases the numbers in a high demand of alcohol. That was from a study from published medhealthcentral.gov. It went and studied like 637 adults that use alcohol and got the reasons why they use it. Most of the reason is therapeutic. Yeah.
I see.
Yeah, I mean, in all of my research, I get to the end of my research, and then like one of the last notes I take is like I didn't find any medical policy or applications for alcohol.
The only medical application for alcohol is them trying to find ways to combat alcoholism. There's no medical applications for
Yeah,
alcohol.
you're talking about the medical reactivity
Alcohol's,
to consumption.
yeah, the alcohol's research is mainly based on the enactment of new policies related to alcohol awareness, alcoholism, or alcohol moderation.
Yeah.
It's not to find medical uses, it's to how do we deal with the problem that we've created thus far. That's about it.
Yeah. And again, like when I'm looking at it, words mattering a whole lot. We do say recreational, but at a certain point, these things are talking about adult use. So it's not necessarily like a recreational fun thing. It's just that you're an adult, you have your own agency. The policy is you should be able to consume or utilize these things. You know what I mean? But again, like I didn't have to try to be persuasive with my own opinion in any of this research. It's like just by stating policy and
Just by the
statistics
research alone, you
from
can see.
legitimate sources, institutes of health, like institutes about alcoholism and abuse. Like it didn't require any opinion at all within my research to kind of like for it to seem like policy doesn't seem sensible relative looking at cannabis policy. You know what I mean?
Right. Well, that's all very nice to hear, host.
Well, that brings us to our conclusion. We just covered recreational alcohol and marijuana. So, with this, Brandon, John Paul, I'm the moderator, Alvin. It was great speaking to you guys.
Shows out.
Good job again, sir.